Welcome to our quick review on periodontal diagnosis and non-surgical treatment planning. So here's a periodontal classification at a glance. If you suspect your patient has more than periodontal health, gingivitis, or periodontitis, always refer to the journal, the original articles, to find matching diagnosis for your patient. But today, we're going to focus on three most common clinical diagnoses that you're going to see with your everyday patient. First of all is clinical gingival health, that is defined as absence or minimal level of clinical inflammation on either intact or reduced periodontia. Secondly, when the inflammation progresses, then it becomes localized or generalized gingivitis. It could be on either intact or reduced periodontia. The third most common clinical diagnosis is periodontitis. It is defined as either interdental clinical attachment loss detectable at greater or equal to two non-adjacent teeth, or buccal or lingual clinical attachment loss greater or equal to 3 millimeter with pocketing greater than 3 millimeters detectable at least two teeth. So look a little bit deeper into definition of gingival health and gingivitis. To differentiate between clinical gingival health, localized or generalized gingivitis is primarily based on the percentage of bleeding on probing. When bleeding on probing is minimum, less than 10%, we determine that's clinical gingival health. Gingivitis is defined when bleeding on probing is greater or equal to 10%. Localized gingivitis is when bleeding on probing is between 10 to 30%, and generalized gingivitis is when bleeding on probing is greater than 30%. So based on our periodontal diagnosis, common non-surgical treatment plan include for gingival health or gingivitis, we will recommend periodontal prophylaxis every 6 months. For periodontitis, scaling and root planning should be the first step of non-surgical periodontal treatment, followed by reevaluation in 4 to 6 weeks after the soft tissue heal. Evaluate the healing and result of your scaling and root planning to determine whether the patient needs to be referred for surgical management or the periodontal disease can be maintained with periodontal maintenance every 3 months. Let's take a closer look at the definition of scaling as well as root planning. Scaling is defined as instrumentation of both crown and root surface of the teeth to remove plaque, calculus, and staining. Root planning is a treatment procedure designed to remove cementum or surface dentin, so only on the root surface that is rough, and then with calculus or contamination with toxin or microorganisms. Therefore, when we're doing prophylaxis for gingival health and gingivitis, we want to remove plaque, calculus, and staining from both exposed and unexposed surface, both crown and root of the teeth by scaling and polishing to prevent or control the local factors. For periodontal maintenance after scaling and root planning, it should be to help maintaining oral health for the patient. So please keep in mind that periodontal maintenance after SRP is not the same as prophylaxis.
I hope this short video review helped with your clinical diagnosis and treatment plan. More detail about staging and grading of periodontitis can be seen in another separate short video review. Thank you for watching.